Welcome to the next installment of the World AIDS Museum Educational Center Spotlight Series. And we are so excited to have our future guest today. And for those who don't recognize his face, and I don't know who wouldn't, this is Dr. Larry Mass. He has been at the forefront of the HIV history from the early days, from writing the incredible article and significant article from the New York Native, as well as being one of the co-founders of GMHC. And so we're excited to have a conversation about this. I'm Dr. Raquel Lopes, acupuncture physician and executive director of the World AIDS Museum. And with me is Andrew Ruffner, who is the director of education and program. So let's get to it. Welcome, Dr. Mass, and we're so excited to have you here.
Well, thank you so much. It's really it's a great pleasure and a real honor to be here. You know, my awareness of the World AIDS Museum came when I wasn't even I was scarcely aware of it when I heard that Larry Kramer was visiting here and that they set up a program, and I just heard the most wonderful things about it from Larry and from others. And then I finally visited the museum myself, and I was so impressed with the electronics, some of the visual things that were there, and the various artifacts and collectibles and memorabilia and books. And so I just think it's Larry Kramer, obviously, this is something that he would care about, and he was honored to be here and all of that. But Larry's not someone who throws out compliments lightly,
No,
and
no, yeah.
the level of his enthusiasm was such. I mean, it was more than, I mean, it was really what I appreciated was that it was deserved. It was
Hmm.
something not just a matter of amounts or programs or anything else. It was the overall institution and what it was doing, and he was genuinely moved and impressed by that. Me with him. So
Yeah. Well, I appreciate that because really we're here to talk about how stigma has affected us all and the stories that are everyday stories of people who are living with HIV and who have intersected with HIV throughout its 40-year history of what we know about it. And so that is really the crux of what we try to do here is to really do the documentation, the remembrance, and the empowerment around the story of HIV. And so we're excited to have you here and really start to talk about your history with HIV. And I guess the first question that I have for you is you had gotten to New York City in the late 70s, early 80s, if I'm correct.
79,
Yeah, from Boston. So I do
right?
remember you saying that. And then in 1981, you wrote this cornerstone of article in the New York Native about what was going on. And so my question to you is, what led you to really want to the importance of that article at that particular time?
Well, I had begun my writing as a watchdog. My writing for the gay press as a watchdog for what was going on in psychiatry. Remember
Mm,
that they declassified homosexuality as a mental disorder in 73 and
right.
74. But as it turns out, that was not a very popular move within psychiatry. And there was a lot of reactionary movement to reclassify homosexuality. Coincidentally, and while I was still in Boston, I tried to come out for, I had planned to do a second residency in psychiatry, and I casually came out during interviews for the psychiatric residency, and I encountered astounding homophobia. So, to kind of fast forward, I got very involved with gay psychiatrists, and when I wrote my first pieces about what was going on in psychiatry, sex research, and when I got to New York, I was doing this in the gay press there. The major outlet was the New York Native, And, you know, I was writing culture pieces as well. Some of the pieces that I was doing about psychiatry and sex research were medical pieces. Coincidentally, I was a physician, and I was sort of developing my own casual feeling for what I call community medicine. There was not much out there. There was one clinic, Gay Men's Health Project. Not much had been done, but there were a number of us on the fringes of in various forms of community medicine doing kind of independent work. And one day I got a call from Dr. Joyce Wallace. She was my colleague and friend in community medicine. She was had been doing outreach to streetwalkers, to prostitutes who had no medical care of any kind whatsoever. They were illegal. They were just complete outcasts. And so she saw in her situation a kind of kinship with the gay community, which is also an outsider community, no civil liberties, no. And anyway, she called me one day. This is like in late April of 1981. She said, Larry, she said, there's something going on. She said, these are not exact quotes, by the way. I'm paraphrasing. She said, there are there are apparently some gay men in New York City intensive care units and emergency rooms, very sick. There have been a couple of deaths. She said, I really can't talk to you. They told me I can't say I really talk to you about this. She is apparently had been told by some health officers or people at the hospitals not to discuss this with anyone. Very, very hush hush. She said, don't write about it. Don't tell anybody about it. So I mean, I think obviously in her own way, she was trying to alert us to a potentially alarming situation. So I called the New York City Department of Health. I said, I'm not going to tell you who I spoke with. I said, but I got a couple of anonymous tips that there was something going on, and what can you tell us? I spoke to Dr. Steve Phillips, and he then told me the information that became the substance of that first news report. It became the first report in the press, even the medic published report, even among even the medical press came a few weeks later. So it was the first published report of what became AIDS. Um, but so basically, what was there was, are we dealing with a potentially serious epidemic? And there was too little known at that point to say anything like that. They didn't say that, so it's just a small news item on page, an inner page, and it says the editor of the Native entitled it "Disease Rumors Largely Unfounded." We sort of said what we knew, and so at that time, I was very much a gay community, gay activist. I was extremely concerned about civil liberties, about homophobia, about the things. So, you know, you have an epidemic going on in gay men. That's serious. That's important. People need to know about it, right? But consider the seriousness and danger of that situation. No civil liberties, widespread, very serious homophobia. And you don't want to set off all the alarms without at least knowing what you're a little bit more what you're talking about. So what is it you're going to tell people? We didn't even have enough information to have any certainty that it was sexually transmitted. As a matter of fact, we didn't have that certainty for another 3 years. We didn't know for sure that it was a sexually transmitted disease. We figured sexually transmitted diseases played roles. That we were pretty sure of. But there wasn't a clear pattern of epidemiology of communicability linking the gay men to one another until the sort of notorious patient zero, and that became a very complicated, fraught situation that more was revealed about later on. So this very first news article was in fact just a little news story of several paragraphs. It was not a feature. That feature that I think you're referring to, that came several weeks later, July 27th. That was the first big feature on
Hmm.
AIDS that I wrote, on what became
Exactly.
AIDS. It wasn't called
Mhm.
AIDS at that time.
Right.
And they called it, the title, the editor titled it Cancer in the Gay Community. I remember being very uncomfortable about that title because from the beginning, I I had this terror that they were going to do something, and which they did immediately. They called it gay cancer and gay related immune deficiency. They were going to do what Trump did with the COVID virus, the China virus, all this stigmatizing nomenclature that, so I was afraid, I was worried about that from the very beginning. And so I wanted to, diseases are not gay diseases, they're not Spanish diseases, they're not Jewish diseases, they're not Asian diseases, they're not Chinese diseases, they are diseases, they're viruses, so that gets into a whole other thing. And if I go off on too many tangents, just hold your hand up because I can
I,
do
I
that.
yeah, I
Go
do have
ahead.
a question for you.
Yeah.
So at that same time, so July 25, 25th,
20, yeah.
25th, your this article came out. Um,
27th. Yeah.
27th, sorry. Thank you. In April, we had something small coming, or small, but coming out of the CDC. And
Yes.
then we had Dr. Altman's the article. How do you
July
see
5th. Yeah.
July 5th, July 3rd, actually?
July
Um,
3rd. Thank you.
yeah,
Yes.
coming out at the same times and how they all mesh together. Because I get a sense that you were trying to, in this article, um, provide information and education as a way to say, okay, we haven't had anything, but this is what I knew. This is what
That's
we know
exactly
right now.
accurate.
Mhm.
That's exactly accurate. I was a very much a gay activist, a gay liberationist, but my my medical thinking was relatively conservative in that, I wanted reasonable proof or demonstrability of a thesis or a probability. I was very concerned about, conspiracy theories and going off on tangents and different, ideas of, what might be causing it. And I was relatively conservative in wanting to real proof of whatever it was that we were dealing with because it was such a volatile situation and so much was at stake. And, in fairly short order, I came up against Larry Kramer on this. Larry Kramer was my friend for 50 years. I had known him since the 60s. And, Larry had written this novel Faggots, which was a very major indictment of the community for really not finding for just being very, very sexually indulgent and preoccupied and not really linking that with responsibility and love. These turned out to be valid criticisms, but we had no civil liberties. Larry had no track record of activist involvement in the community. So we really weren't sure what we were dealing with. We didn't, there from the beginning. Larry was maybe the person pressuring us the most to just abandon everything we had held sacred as a community in terms of our values, our celebration of sexuality, all of that. And I was certainly concerned about the community and our health, and and all that. But I wasn't sure that we were ready yet to just consign the whole thing to the dustbin. And especially, I was very concerned about civil liberties and our vulnerabilities. The White trial for the assassination of Harvey Milk and Mayor Moscone, that had happened just in the same year, earlier that year, 1981. The the country was a keg of potentially explosive homophobia around. It happened around the Dan White trial. There were major riots. There were gay instigated riots, but I mean, you just had this feeling like there were major forces in the country that would be happy to put us in concentration camps. People talked openly about that on television. There was a psychologist, very well dressed, very well spoken, well groomed gentleman named Paul Cameron, who spoke very, very calmly about that we should all be rounded up and executed. We should be either gassed or I don't know what it was a mass murder scenario, but he was very calm and collected and well spoken about it, and he would appear on these talk shows, and we were, so um, Larry Larry Kramer actually never got anything exactly wrong. Um, oh, it's a very complicated situation, but in his play, The Normal Heart, he has a scene with Dr. Bruckner, this doctor based on Linda Laubenstein, and she says, this is a major epidemic. This is very, very serious. And he says, what are you asking me to do? And she says, you're the lead. It's just something to this effect. I'm not quoting exactly. She says, you're the leader. She says, you have to tell them all to stop. And he said, stop what? Stop having sex. So he says, do you realize that you are asking me to do the thing that the whole community is all about? And this is where the community's values primarily are. This is everything to this community. To tell them to stop having sex is simply inconceivable. Larry actually never did specifically ask for that, but he wanted much more aggressive action. Where I was coming from was I'm willing to tell people anything that's reasonable based on the evidence. So, okay, stop having sex. Okay, but exactly what? Blowjobs, stop kissing, stop anal sex, stop fisting. What are the different things that we have to stop doing? Because not everybody in the community was sex crazed. Not everybody was. There were people in the community who were having many partners on a daily or many partners frequently on a daily basis. It was common, but there were others who weren't. I mean, this thing of quote promiscuity unquote. I used to use that word in quotes early on because I really was very uncomfortable with it. I mean, what exactly is promiscuity? Is it having sex twice a day or with more than one partner a day or how often or so okay and so there was a lot of wild thinking that developed almost immediately a lot of different theories of what was going on. One of the strongest early on came from Dr. Joseph Sonnabend and his two patients and became leading gay activists, Michael Callan and Richard Berkowitz. Their view of what was happening was what we call multifactorialism. They felt that people were getting there was so much fucking that people were getting multiple sexually transmitted diseases. And it is known that if you get multiple sexually transmitted diseases, you get enough of them and for long enough and often enough, that can be a cause of immune deficiency. So that seemed a plausible explanation. And on the basis of that, they quickly came out with a manual called How to Have Sex in an Epidemic, which was the first real safer sex guidelines, and they recommended condom use. There was a lot of good stuff that they did early on. Unfortunately, they held to this theory of multifactorialism to an extent that quickly revealed itself to be not that rational or persuasive. It didn't explain the epidemic in the other risk groups. Maybe in drug addicts it did, but not. I mean, the sexual component wasn't that. It could explain it, because of needle use among drug addicts and among the hemophiliacs, but it didn't really make sense for the African nationals, the Haitian nationals that were the other major risk group. It just really wasn't holding together as a satisfactory explanation. More likely, and this was something that Larry picked up instinctively early on. It was a primary agent of some sort, probably a virus, but it proved very, very elusive to demonstrate the epidemiology. So there continued to be all this speculation, including from a lot of leading, prominent people. You could speak to Anthony Fauci about this. You could speak to many others. We weren't completely sure. Larry had a gut sense that we were probably dealing with a primary agent of some sort, and that whatever it is, we had to move very, very aggressively forward to organizing, to giving out information, to networking, to doing all the things that we did. What finally happened in the course, so and Larry was totally right, you know. So Larry became very, very driven, and he was a good leader, and this was all good. At some point in this early development of GMHC, which is primarily an information and service organization, Larry really kept veering ever stronger into the need for a much more activist organization, an ACT UP. Okay. GMHC was primarily formed as an information and service organization. It was not really meant to be the street activist organization that invaded the FDA and the church and all this stuff like that. Those things were wonderful. They achieved miracles. No amount of praise could be overpraised for ACT UP. It is one of the greatest things that has ever happened in the history of the world. But what Larry really wanted was for GMHC to become ACT UP. That was never really the right thing to happen. The question that you're left with at the end of it all is, would it have been a good thing if GMHC had become ACT UP, or are we better off for having had both organizations? I think most people would have to concede that the answer is the latter. We're better off for having had both organizations. GMHC has contributed mightily to the AIDS epidemic. It's done a great deal of good at multiple levels. It was not the heroic, thrilling activist organization, grassroots healthcare activist organization that ACT UP became, but it played its own part, a very respectable part, and continues to do so. So, so I,
Yeah. So, gosh, there's so much in there. I think for us at the museum, we've had this experience this year of when we encountered the Sandy Ford family. They came to us, the daughters of Sandy Ford, who was the drug technician at the Parasitic Diseases Drug Service at the CDC, and was telling us about her connecting the dots on these cases. And I think one of the things that I'm really impressed by here at the museum is that if you keep following the garden hose back, the story has something. These things don't just emerge from nowhere. There's something that came before that allowed it to be the thing that happened. And so one of the things I think is interesting when you go to the GMHC website is it's got the thing about the meeting in Larry Kramer's apartment that was the birth of that, and that there were 80 men that came together. Is that actually true? So number one, I have a real estate question about that, in terms of that many people being able to be in a New York apartment. It must have been huge.
Well, the first meetings in Larry's apartment were much smaller. There were just a few of us. I can't remember the exact sequence or how many there were. There were 2 or 3 before the 80 people got together. That was via outreach for a fundraiser to raise money for what at that time was called the KSOI Research Initiative. I think they have that title right. That Kaposi Sarcoma and Opportunistic Infections Initiative. Just that nomenclature tells you how uncertain we were about what this was and what the cause was. KSOI, Kaposi Sarcoma and Opportunistic Infections. We didn't have an overall name at that point that totally, included everything. The name AIDS didn't come into use. It didn't become official until the winter of 1982. So the first meetings in Larry's apartment were several of us. I believe it was the 6 of us who became the co-founders of GMHC. Myself, Paul Popham, Edmund White, Nathan Fain, Larry, and Paul Rappaport. And, there were a number of subsequent meetings based around getting people involved and getting people to donate and setting up future plans for fundraisers and research and doing all the things. There was a lot of envelope stuffing. We had several events. There was like a dance event at one of the discos, and there were house parties in Fire Island and in the Hamptons, and all kinds of ways of to raise money.
Well,
Larry was
I just wanted to
that's the GMHC. I see that in the background. That's for the rodeo. I think that was 1983. That was the first really big event in Madison Square Garden, and it had like Leonard Bernstein conducting. I don't remember what he conducted, but it was a big, huge, successful event. Larry was the great leader of it all. There's just no question about it. He was the one who was galvanizing everybody, pushing everybody on every front. And for someone pushing as hard and as loudly as he was, it's amazing how little he ever got wrong. He did, I think, get some things kind of wrong, like this business. I mean, he at various points he was so angry at GMHC that he really, he just blasted us, and got to the point where we just couldn't function. Actually, I had resigned from the board at that point, so I wasn't involved in that decision to separate itself from Larry. But that's the sort of stuff of the plot of The Normal Heart. So, but Larry was this great leader who did all this work and then went on to become the founder of ACT UP. Now, if you really want to know about ACT UP, I mean, there are a number of major resources for that, and that the importance of ACT UP cannot be overstated. The most recent current one is Sarah Schulman's book about she ran what she called the AIDS Oral History Project, the ACT UP Oral History Project for more than 20 years, and she had literally I think hundreds of interviews, extensive interviews with all the people involved, and she has very insightful observations about how the organization worked and what they did and what they didn't achieve. Larry was the figure who got ACT UP going. I think if you talk to a lot of people in ACT UP, they would say that Larry was not as much a presence in a lot of what happened as legend has it. He was this figurehead. He was the spirit, this guiding spirit, and he deserves a great deal of credit for the founding and the flourishing of ACT UP. But a lot of what ACT UP did, a lot of their, they did so much. They did, it's just kind of breathtaking. A lot of that, credit goes, as it should, to a lot of other people. Sarah is one. Peter Staley. I mean, there were, and a lot of this is in David France's book, How to Survive a Plague.
Yeah, before we run out of time, I really would like to, one of the things that I was so happy to see you come to our community dialogue that we had last week about the Chronicles of Don't Ask, Don't Tell. So I'm going to kind of like fast forward us all the way from 83 to right now. But thinking about that, you know, we put that community dialogue together to talk about HIV disclosure today in the context of having all of these resources that we have now in terms of PrEP and undetectable equals untransmittable, and the new injectables that are rapidly being approved. And they actually, I couldn't believe it, the injectable's already on formulary for the Ryan White program, which is amazing. But just kind of wondering, as you look at all of this from where you were in 81, and here we are today, and we're having these conversations. When I talk with younger people, I'm kind of in the middle here on this, but when I talk with younger people about this question of how do we disclose HIV status? And so when we're down on the individual gay man's perspective, like what do you think of where we are and where are we headed around HIV at this point as a
Well,
community?
when when I started out, I mean, I did what was the first, very early on, what was the first published interview with a person with what later became known as AIDS. He had KS. He was interviewed with a pseudonym. He couldn't dare say
Right.
who he was. I mean, he could have been fired. He would have. People were routinely fired from their jobs, evicted from their homes, and what do you call it, from their families, you know, disowned by their families.
I think
This was
ostracized. Yeah.
ostracized. Thanks,
Yeah.
and their social networks. I mean, it was you know, it would be a disaster if anybody found out. So well, you know, of course, in those days they didn't have testing at all. So the testing didn't come until like 1984. So you know, so to me, it's all, you know, almost unimaginable progress. I mean, to me, although there were several very bad turns, like the AIDS denialism and the catastrophe of what happened in South Africa, loss of a third of a million people from AIDS denialism. AIDS is a extraordinary success story at so many levels, for, you know, for medicine, for science, for health, for the gay community, for people with AIDS. You know, as we see during this current reactionary political period, we could, you know, history can turn on a dime. I mean, suddenly we could be back in the dark ages. We were actually, but no, I think it's a great success story. I just I'll try to wrap this up, but I never remember when Larry Kramer called me and told me calmly um, that these drugs that they had been fighting for, you know, at the street level with these major protests and there's all these confrontations, that these new drugs actually were reversing AIDS. I said, Larry, come on, you know. I didn't believe him. He had to repeat it like 8 times. It was unimaginable. There had never been prior to this a fully successful treatment of a virus. There was a cyclovir for herpes, which kind of kept it at bay a little bit. Um, but for a deadly viral disease, there had been vaccines, like for polio and things like that, but there had never been a successful treatment for a virus. So this was absolutely epical, scientifically and medically. So I just couldn't. I said, you know, Larry could be very, you know, I thought maybe, oh my God, is it one of Larry's, you know, exaggerations or overstatements, or, you know, you know. So I mean, I was just breathless for days when the news kind of settled in. People were literally getting off their deathbeds. This happened with a number of people. They were, you know, they were being given last visits by friends and family, last rites, all these things. And 2 days later, they were getting out of bed, or a day later. So to me, what's most impressive is the miracles. But the AIDS denialism thing, and in the face of what we've just been through with COVID, we see that these, conspiracy theories and contempt for science and all these things, these these are their own chronic plague, a plague that, we're still nowhere near in sight of a cure for. The plague of ignorance, the plague of, you know uh, um, prejudice, combinations of those, and stigmatizing and scapegoating, all that stuff, that remains a major plague that I don't have nearly, that I wish I could have more hope for, but it's hard. It's hard to in the present climate.
It's interesting. You talk about the, for me, a game changer in the biomedical interventions that we had, that you're right. If you really think about it, and I don't know if I've ever really thought about it this way, is that the treatments for HIV were astounding in the face of
Astounding.
it. And so I don't know that people really get that prior to this, there were no treatments for viral diseases like polio. Um, and so this was a game changer for people's life and longevity. Yeah.
Well, that's why, Anthony Fauci, who had this legendary, on-off love-hate, continuous battle with Larry and the FDA, and also Anthony Fauci still has a lot of issues with Larry, and as does Larry, and did Larry with Fauci, as revealed in his novel, The American People. But Fauci describes the whole situation as, in the history of medicine, as before Larry and after Larry. Now that leaves out a lot of important people who did a lot of the most important work, and all of that, But I think that that's really accurate. It's like before Larry and after Larry. Talking about not only the history of medicine and science, but grassroots healthcare activism. There was never anything comparable anywhere in the entire globe to what ACT UP did. These confrontations with all these leading scientific institutions, and the getting involved in all the protocols. I mean, it's simply mind-boggling what that whole uh, uh, what that organization did, what those people achieved, and so I have a lot of positive feelings about the AIDS epidemic, and about all the progress that it represents. I hope we don't lose, our footing with all of that, which I think, is always a risk. So,
Well, I am so sure that there is another opportunity to really delve in to some of the conversations that we only touch the surface of. And, I look forward to that opportunity or possibility. But we typically wrap up the show by asking, well, I'm going to ask you, with all the work that you have done, what is it that you do for relaxation, for downtime?
you know, I, um, I think I'd have to say it's the writing that I do that's also my activism. But one of the reasons Larry Kramer is so dear to my heart, and despite all our fallings out, um, is that Larry was a real writer. It's very difficult. People, because of Larry's incredible achievements as a gay activist and AIDS activist, and people do understand he was a writer and an artist, but they don't realize how serious a writer he was. He was absolutely devoted to his writing. Um, And I really related to him in this. And he was the first writer, colleague, friend to tell me that I was a writer and that I had my own voice and my own things to say. And that the things that people told me were liabilities, like going off on tangents the way I do, that was an asset because it was me and it was my voice. So anyway, to make it to try to answer your question, I'm writing more than ever now. I'm completed another memoir, which is a lot th- about my involvement in the world of music and opera. There was a kind of major personal life involved. That's kind of the world that I came out in, you know, the world of opera people, and I was a lot of sort of my coming of age and coming of awareness and my first loves and all of that took place in that milieu. And I have continued periodically to do that writing, and I've finished a second memoir, which kind of combines all these different things that I've been so interested in, all these bear culture, the leather culture, opera, music, you know, film, science, medicine, health. You know, they don't fit together neatly, but they're all sort of me, and I enjoy my writing about them now as much as ever. And I think otherwise, clearly, I enjoy, you know, good food. It's
We all
another
do.
issue,
We
but
all do.
so
Well,
uh,
well,
anyway,
well, thank you so much. I feel honored and privileged to have had not only this conversation with you, but others on the phone leading up to this. It's so comfortable to have conversations with somebody who has a rich history and is willing to share that with people. And there are intersections in my experience in New York City during the mid 80s on that really lends to the conversations that you have shared with us. So I want to thank you for this opportunity and thank you for the time that you've taken with us. And
thank
it's
you so
amazing.
much and for all the wonderful work that you do at World AIDS Museum. You guys are
Mhm.
the best.
Yeah.
Thanks.
Well, I just want to wrap up and end this segment with letting you know what our next spotlight series will be with, and I'm going to let Andy tell you about that.
Okay, so next up, coming up on Wednesday, August the 4th, at 5 o'clock, we'll be talking with Mamie Harris, who was the founder of For Carice, which is a Afrocentric, faith-based HIV prevention program. She started in Cincinnati, Ohio, and really did a lot of great work in connecting people to services that had not really been addressed previously. So she's going to talk about what it was like to get that started. I had the privilege of working with her on a bunch of different projects during my time there. And so we're going to have fun talking about getting something like that started in a town like Cincinnati.
And once again, I want to thank everybody for tuning in to World AIDS Museum's Spotlight Series. World AIDS Museum is here to document, remember, and empower the story of HIV. We hope you stay tuned and come and visit us. Have a great day, everyone.